same time warp as most folks might be. Thank you, Kyle, for that introduction. Thank you, Philadelphia Fight, for persevering and holding this important conference throughout the month of June. I'm always really excited and looking forward to participating in this conference. As Kyle said, we always try to work with Philadelphia Fight every year. We are members of the Adolescent Initiative from Children's Hospital of Philadelphia. I'm the clinical and research director there, and Anderson is one of our clinical research coordinators, and we work within the Division of Adolescent Medicine. And as Kyle mentioned, today we'll be presenting some of our work using social media on the PUSH project, a study that's taking place in Philadelphia, Washington, D.C., and in Baltimore. We're going to start with some brief background and provide some overview on the project, describe how we came to create a presence on social media and develop our content to reach, recruit, and retain participants, and then share some of the initial outcomes and lessons learned. So as we all know, the U.S. National HIV/AIDS Strategy in 2020 calls for increasing access to care and improving outcomes for people with HIV and targeting biomedical prevention efforts. Baltimore, Maryland, Washington, D.C., and Philadelphia are disproportionately burdened by high and increasing rates of new HIV infections, with disproportionate rates being among young Black and Latino men who have sex with men, especially ages 15 to 24. And high incidence underscores the need for increased identification, linkage, and reinitiation in HIV treatment and preventative care. Next slide, please. Thanks. Most adult interventions don't account for the developmental needs of youth. Well, at least that's what we found as adolescent providers and researchers. Oftentimes, these interventions focus only on one pillar or one area of the treatment cascade, as opposed to multiple steps along the cascade. At times, these interventions fail to incorporate prevention into the cascade, and they fail to address some of the comorbid factors like alcohol or marijuana use. And what you'll see here is the HIV care continuum by ages in the US, and I'm sorry that it's a little bit small, but if you just glance at the first area, the first block of the chart, that represents ages 13 to 24, and you'll see that within all of the different factors of the continuum, which include viral suppression and retention, which are the latter two bars there, young people ages 13 to 24 are still significantly under the curve compared to their older counterparts. Next slide, please. So as researchers focusing on adolescents, we wanted to create and work on an intervention that not only addressed the different areas of the cascade, especially the latter portions, which dealing with viral suppression and as well as retention, but also something that was appealing, something that was able to be flexible and also that was responsive to the needs of the young people. So here comes the PUSH study. The PUSH study is a collaboration between, as I mentioned, folks at Johns Hopkins, folks at Children's in DC, as well as in Philadelphia. I want to acknowledge some of the other co-PIs, especially Renata Sanders, who's at Hopkins, who really spearheaded this work. And so I'm going to tell you a little bit about what the PUSH study is. And hopefully a few of you have heard of it before, seen some of our logos, seen some of our advertisements in the community. PUSH has been in effect for over 3 years now. So the PUSH study, or Promoting Unique Support for Health, is a multi-site, multi-arm HIV prevention study for Black and Latinx sexual and gender minority adolescents and young adults assigned male at birth. And what we're trying to do is test an app that features a health coach, so an actual human trained in motivational interviewing, and to see if that would help with medication adherence for PrEP and or for antiretroviral therapy. And you see here, that was one of our initial ads. So the aims for the study in a little more detail are, for the first, is to use respondent-driven sampling, RDS, which is to identify folks in the community who can also bring and help us to recruit other folks to join the study, to recruit these young folks in 3 urban cities. And we're looking at folks who are HIV infected but not virally suppressed, folks who are high risk, but uninfected, including those who are gender nonconforming or transgender females, and those who are HIV status unknown. The second aim is to compare the efficacy of 2 study arms. So we wanted to compare folks who are using the mobile enhanced engagement intervention, which means the app as well as the coaching, versus standard of care. And we are looking at not only in aim 2, we're looking at folks who are HIV infected but not virally suppressed, and in aim 3 we're doing the same but looking at folks who are HIV negative but maybe are engaging in PrEP. Thanks. And here's our basic study flow. So you see there's aim 1. We are looking at, we were trying to engage folks primarily through respondent-driven sampling. Folks will get randomized once they are enrolled, and they'll either go into aim, depending on their status, they go into aim 2 or 3, and then they're randomized to go to standard of care or into the intervention, and we can compare those 2. Great. So the intervention, we couldn't do this without our coaches. You see here Xander Lopez on the top, and Will Vicroy is the photo below. And these are our 2 coaches. We're really fortunate to have had these folks from the very beginning of our study. They've stayed with us for the entire time. And they were trained in motivational interviewing, which is a directive client-centered counseling style for eliciting behavior change by helping clients explore and resolve any kind of ambivalence. So there's a lot of reflection that happens in this coaching. Our coaches know our participants extremely well. They are very accessible to our young people, and they are trained in navigation for PrEP or for adherence to antiretrovirals, adherence counseling, care engagement, and treatment adherence. But as we know in this work, whenever you're engaging with young people who have a variety of different issues, they also engage them in all kinds of support, whether it be around education, whether it be around housing. And we have a very integrated system within our clinic so that there's referrals that can happen throughout their time that they're engaged in the study. In addition, the young people are able to use an app that's specifically for push. The features on the app include a chat, so they would be able to reach out to the coaches via the chat. We also find that the young people really like to engage the coaches via text message. And then now, of course, through HIPAA compliant Zoom, if that's needed. But there's also a pill cam to remind folks or to check in around adherence. Thank you. Check in around adherence. There's an appointment calendar that they can access. There's a chart that shows their progress, how they're doing as far as their different adherence measures. And then they're also able to go right into the app and take surveys whenever we need to collect them throughout the study. So these are just a sample of some of the frames that they can see in the push app. So there's the first one, which is your welcome app. It tells you what's coming up for you, whether it's appointments or whether you have a dose that you need to take. There's also the chat feature here, which looks a lot like text messaging, but is within the app, which is secured in the app. And another sample here is your appointment details. They're able to see not only when their appointment is, where it's taking place, but also some notes if there's anything that they need to bring with them or remember to have when they come to their appointment so that they're prepared. So this all sounds really nice. This all looks really great, right? We've got these wonderful coaches who have all kinds of skills. We've got this lovely app that's secure that young people can go on whenever they want to. They can ask, but how do you get folks to actually come on to study and engage in all of this? Because if they don't, then kind of who cares? You can build all these things, but if they don't come, it doesn't really matter. So that's really the work that has to happen up front, is being able to reach out and think about what are the right messages, and what are the most respectful messages and most useful messages for young people, so that they will come and engage in the work that we want to do. So we wanted to do this. We realized that doing this under social media was going to be crucial, especially to reach young people who may not be engaging in any of our programs currently. A lot of us have a cohort of youth that come and are able to come and see us, but there's a lot of young people out there that are not coming into our clinics just yet. And they also may not be out in their communities. So social media provides a really good opportunity for us to reach some of those youth. We know that 51% of teens 13 to 17 use Facebook, and 72% use Instagram. So that's makes further the case for us to be able to be on social media. And then systems important for social media use are undergoing a lot of changes in the developing adolescent brain. This is some of the other work that we're finding and that we're reading about, is that how adolescents are using and accessing, and the impact of using social media as a social space for them. We have to be careful about that. There may be a lot of rejection or acceptance. There's peer influences happening within this space that's very different than what's happening in other spaces. And so we really need to be cognizant of that when we're trying to engage youth in this setting. Thank you. While we were developing some of our work, we were able to look into, read, and hear about some incredible work that Robin Stevens from University of Pennsylvania is doing around what has been coined as the digital hood. And for someone like myself who has been doing this work for a long time, but not in a digital space, but has done a good amount of community work, but also venue-based work when it comes to outreach, recruitment, for research, where we had to do some identification of safe spaces, or spaces where young people were comfortable with us to come into and talk to them about research or programming. Now we're talking about this digital hood, which to me, in some ways, resonates with some similarities, but at the same time, it is very different. So it's a third space for living in, to describe social media. Digital hood was coined to describe social media as a third space for folks living potentially in disadvantaged neighborhoods. And what Dr. Stevens has said is that it is important for social media developers, research, and practitioners to consider ways to leverage benefits of social media, specifically as a tool for social connection, community building, while minimizing its misuse. So going into these spaces, we have to be careful, but there's a lot of opportunities there that we should definitely look into. Study staff, we took the approach that by serving as a space in the digital hood for study information, health promotion, and to provide local resources, that potential participants would deem this virtual vision trustworthy and sign up for the study. So how did we try to create, the first thing we want to do is in that vein is to create a presence. We wanted to kind of insert ourselves into that world, create a presence, make ourselves safe. We did a lot of work around creating our logos and creating our taglines. So we started out by creating linked Facebook and Instagram accounts so that we could advertise, we could utilize Messenger, but also post health messages, as well as much information about the study as we possibly could, to be as transparent as possible. And then also to create event pages. We were also able to use these these mechanisms to link with additional partners and other folks so that we could share information, but also show that we had alliances with other agencies. And once we started establishing a presence, we thought about what different considerations for recruitment and retention. And one piece that is really important is consistency. And so setting up a schedule so that folks know or folks see postings on a regular basis, and it's not just here or there, it's kind of random, but on a regular basis, they're going to see that we are a consistent group, that we have information, that we're going to make sure that we share information on a regular basis, not really just when it suits us, but just when it would be helpful for everyone in the community. Again, we use hashtags and geolocation tags to gain followers. So trying to bring folks to the page and increase that presence. And then we used a mixture of content. So we would repost from our partners, but we also made sure to create our own original content. So we weren't just taking stuff from other people, but also creating some of our own work to put out there. And hopefully that was helpful to other sites and they could repost from our site as well. And then we also managed Messenger, and we tried to encourage the use of communication through Messenger. And this required a lot of work on our end to make sure that we were always vigilant of what was being communicated through that mechanism as well. I'm looking forward to answering questions at the end, but right now I'm going to turn this over to my colleague, Anderson Schloop, who really was spearheaded a lot of our social media presence and work and content. And he's gonna give you more details about some of the outcomes of that.
Thank you so much, Marnie. Thanks for going into the background. I'm gonna talk a little bit about the meat and potatoes, how to set up a social media campaign. So we would run advertisements twice per month and vary ad style, image content, headline themes, call to action, and audience targeting using a consensus approach. Next, we'll dive deeper into how this content was customized. We knew that we wanted to group and track effective ads, so we used a consensus approach to list characteristics and themes of each ad. We eliminated redundancies and then came to consensus on the list of categories, then taking a sample of ads and matching them to our generated categories. Metrics such as number of ad clicks and completed screeners were then generated for each category. First, we customize ad style. These are all examples of different ads we generated. The first image on the left is a boosted post, so this means it was created without Ads Manager. It was just a simple Facebook post, and you can use an Instagram post as well and promote it that way. The second ad was created through Ads Manager, which allows users to pick through stock photos, which we'll talk more about. And the final ad was created through Ads Manager as well, featuring a photo that we took and uploaded ourselves. So these give you a little bit of the flavor of what kind of ads we were starting with. We tailored image content in each ad to reflect an aspect of the study. The first ad prominently features a cell phone, a key aspect of the study, while the second ad features sexuality to attract our target audience. The third ad features a drag queen to reflect the gender diversity the study allows. In Ads Manager, users can pick from different stock photos or upload their own photo. Keywords that we used for stock photos were gay, transgender, and cell phone, for example. So you can kind of see all of those in these ads. Headline themes refers to the text seen above a photo in an ad. We customized ours to reflect specific events like World AIDS Day, National Youth HIV and AIDS Awareness Day, Pride, and even events that we were throwing. So you can see on the right, we threw a game night and we advertised for that online, and then we had you come in that way. Headline themes also included giving back to the community by participating in research and helping us test a unique ad. So we tried to pull out themes that we thought youth would find fun and engaging. Call to action refers to the actionable step potential participants take when they click on an ad. So these include sending the study page a message, liking the study page, and leaving their contact information in a lead ad that allows study staff to reach out via the participant's preferred method of contact. Audience targeting refers to the metrics behind the scenes that allow study staff to tailor who can see the ad. Now, this can get a little bit interesting, and I think this is where using social media for good can come into play versus bad. Our ads were shown to users ages 15 to 24 years old in the greater Philadelphia region. And you can also target by gender and likes as well. And so you'll see under the detailed targeting piece, that's a feature that you can use for every ad if you like. And you use likes that we utilize are Black Panther, BuzzFeed LGBT, pronouns, and Vogue dancing. For detailed targeting, staff cannot choose local landmarks. It is more general to interests that have millions of followers. So over the course of 16 months, Push Study interfaced with 239 adolescents and young adults via social media outreach. 48 of those indicated their interest in the study, 32 completed screening, and 20 enrolled. And you can see the most popular ads, which I'll go into at the bottom of the page. So I'll give you a second to look at those. Ad 1 was the ad that generated the most Push Study enrollees. It is colorful and depicts a stock image photo of a happy couple representative of our population. This ad was run during Pride Month, which you can see from the headline. The call to action button is to sign up, which means to leave one's name and phone number for staff to use for content. We targeted the audience by filtering for users who are interested in cosmetics, Vogue dancing, LGBT community, Black Panther, Janet Mock, Laverne Cox, and male. 7 people reached out to us due to this ad and 6 enrolled. For ad 2, it is another colorful ad featuring 2 sexual minority males with cell phones, another ads manager stock image. The headline theme is attributed to community, and the call to action was to sign up in a lead ad. There was no audience targeting, interestingly, for this ad, but it was shown to all males ages 15 to 24 years old in the greater Philadelphia region. 17 people reached out to us via this ad, which is really exciting, but only ultimately 3 enrolled. Finally, ad 3. This is a stock photo image of an affectionate sexual minority couple. The headline is based in community as well. The call to action is to sign up by leaving contact information in a lead ad, and specifically stating that those who do so will receive a text by the next day. No audience targeting was used other than age and gender for this ad as well. 2 people enrolled after seeing this particular ad. So we found that sexual and gender minority adolescents and young adults of color show preferences for social media ads featuring a photo of happy representative couples, which empowers users to sign up for the study by leaving their contact information in a lead ad. Interestingly, we also found out that messaging was a crucial tool and one that is, I think, really underutilized by other social media campaigns. Because what we would do is whenever anybody would leave their contact information or like an ad, we would give them a message to follow up with them via Instagram or Facebook. And this was really effective for screening and enrolling this vulnerable population. I think it led to more people who are interested than just signed up by leaving their contact information as well. So what did we really learn and we want you to know? We really recommend that you know your audience and that you try to enlist help from your audience through the study. So for us, we would enlist the help of you to make sure that our ads were on track. And something early on that we heard was that happy representative photos of sexual and gender minority couples were really inspiring for you to see and made them feel happy as opposed to like a sexy image that might be used to target them as well. It's really important to monitor ads and comments and reactions for hate speech. Unfortunately, that is something that we did see from time to time and that we did monitor and have to take down. So if you are someone who's going to be implementing an ad campaign, just make sure that you have somebody who's looking at the ads every day to make sure that nothing inappropriate is on the ads each day. It's important to leverage community partnerships because those are the people who you will use their content and they can use your content too. It shows the youth that there's integration in the city in terms of services. It's important to acknowledge and support important dates and events. So having a calendar of all the different events in Philadelphia and nationally that could pertain to a particular group is really important. create a schedule for postings, which is modified as needed. So we would post at least 3 times a week, if not more. And then we wouldn't post on the weekends because we didn't have somebody to do that. Hold regular brainstorming sessions with the team and youth for content. So it's great to have one person on the team who is in charge of the ads, but if you can get other people to flex their skills as well, they can create ads on your team too. It's a fun team building exercise we found. And ensure that staff can respond to any messages within a timely manner. Track the times of day that yield the most views from your audience and allow for flexible schedules. So those are the references that we used. And thank you so much to our entire team at CHOP, at Women Walker Health in DC, at Children's National in DC, and Johns Hopkins in Baltimore for making this project such a success.
And I'll just add, because there's also a question, this is a study that's funded by NIDA, National Institute of Drug and Alcohol, through the NIH.
Wonderful. Thank you so much for that presentation. I think as we all have pivoted recently to complete digital work, I think this study lends itself to continuing that work. So I'm really happy you all have, started this and set a precedent, so to speak. So we have a few questions, and I want the audience to stick around and really put on your thinking caps and ask all the questions you have. This is the time to do so. So our first question asks, what is a pill cam? Can you elaborate on that?
Sure. A pill cam would be for someone who's taking PrEP for their ART. And they could take a photo of the pill that they were about to take to let their health coach know that they successfully took their pill that day. It was just a way to engage with the health coach around medication adherence.
Very cool. So the app would, ask for permission to use someone's camera on their phone, so to speak, I guess, and then like the photo would be sent via the app, correct?
Precisely.
Wonderful. Very cool. Very cool. The next question. What were your social media benchmarks, such as number of followers, number of likes, or number of posts a week? So what were your metrics? What were your goals with those?
That's a great question. So that really depended on what our call to action was each week, and we tried to vary it. So as you can see, we did ask people to like our page from time to time, but we noticed that ultimately didn't give us anybody who enrolled in our study. It just gave us people who liked the page. And you know that when you have different research studies going on, you need to be enrolling and screening participants. So ultimately, we were hoping to capture enrollees. So that is when we would get creative, and we would have the lead ad for people to leave their information, or we would have Messenger to have people message us. So those were the metrics that we used for success.
Wonderful, thank you. And I really wanted to make a note. I appreciated how there was two folks that really, I imagine they put a lot of care into their interactions with all of the participants, and I think, when you do a study like this, you want to build that trust. So having those two folks interface one-on-one with the participants, I imagine built up a level of trust and a level of camaraderie is the best word I can think of just from my observation. So I really appreciated that level of care and interaction.
We also would sometimes feature them in the ads, and that wasn't as successful as we hoped, but it definitely had people recognizing them in the community, which was fun.
Very cool. Very cool. Our next question. If you discovered hate or inappropriate speech, would you simply just delete it, or were there any other steps?
That's a great question. So depending on what the hate was, I would interact with it, and I would write a response of saying, like, this is a space for everybody, or I'm sorry that you feel that way. And then I would hide it so that other users couldn't see it. And I would invite them to like the page so that they could find out more about us. But usually people didn't do that. Sometimes we would get messages too that were hateful, but I would try to engage with people to just provide some kind of education and let them know what the study was about. And and that this was really like a safer spot for people. So no hate required.
That's great. And that's a lot of labor and effort. I just have to applaud you for that because, dealing with, I think, pushback on, work, I think specifically centered in this study, I'm sure that can become very demanding. So I just wanted to applaud you for taking the time to engage and also continuing the education beyond just the study, but also to the general public who may not know a thing about what they're speaking to. So thank you. Next question, how did you enlist help from the youth community or community organizations throughout the study?
Sure. So we have a really active youth community advisory board that we would go to, and we would bring them different topics. We would give them examples of ads, or we would ask them what they wanted to see in ads. And they were always right on. So if you have access to a youth community advisory board, or whatever your population is, whatever kind of community advisory board that your potential target population would be a part of, I think it's really helpful to be able to do that. And then, of course, as far as partnerships in the city, we would like any kind of community-based organization or medical service organization on Facebook and Instagram, and then use the retweet app to be able to repost what they posted, so that everybody was always getting a nod for doing that.
I just want to add too that we also went back to our funder and asked to have a small amount of funds released so that we could hire youth consultants or experts, so that in addition to the community advisory board, we could reach out to a young person and ask them to meet with us, once a week or once every couple of weeks for lunch, or just over the phone, if we just needed some immediate feedback, and or if we wanted to just make a quick change around a campaign and we were feeling like we wanted to vet that before we put it out there. So we were able to to get a little bit of those funds so that we could have our consultants or experts when as needed.
Thank you. I really appreciate that, that you asked for funds to compensate the youth involved in this study. I think, I speak as an older millennial. We oftentimes talk about how do we engage youth, The question is talk to youth and also compensate them for their time. So thank you for that. I appreciate that. I think that's really cool. So can we reiterate what SGM and AYA stand for?
Sure. SGM stands for Sexual and Gender Minority, and AYA stands for Adolescents and Young Adults.
Awesome. Thank you. And our next question, what call for action did you find people engaged with the most?
I would say the lead ad. The lead ad used the term sign up. And so I think people really gravitated towards that as an actionable item. So sign up for the study. And then that would send them to a little page that would ask for their name and phone number. And you, as the person who creates the ad, can choose what kind of contact information you want to collect. So dependent on what your IRB requires or what you have put into your IRB, you can collect whatever contact information you want. And I think you can also collect some demographic information if that's important to you as well. And that's uploaded into an Excel spreadsheet that you can download as in Ads Manager each day.
Awesome, thank you. I actually kind of have a follow-up question. So at the beginning of this study, when you all sat down in front of your computers with the different social media platforms at your fingertips, no followers, no likes, nothing. What was that kind of internal process like, or what were your thoughts when you began this study? Like, what did you think to yourself? Did you think, how do we get people? How do we engage? What is this going to look like? What was your initial feelings?
That's a great question. So I think that is a daunting place to start, but that's where everybody starts with their social media campaign. And for me, it was just making sure that we had people who would be engaging with our content and hopefully feeling inspired by it. So that is why we took the approach of being able to post at least 3 times a week, using our own original content, which we made in Canva and Pictochart. So those are two free resources that people can use to generate their own content. And then we would repost other people's content too that was relevant to our study population. So as long as we thought it was something that our youth would engage with, we would post it, and that is what we tried to get people to follow, follow kind of like the brand or the messaging. And I think when you're working with youth, you should try to keep it lighthearted, funny at times. But then also, youth are really interested in social justice too. So posting about current events that are happening is always really important as well, and how you can get involved and how you can take care of themselves as they're getting involved in those social justice realms.
I think one thing that Anderson really ensured that we had was a lot of variety in the types of posts. Was a lot of variety in the types of posts. So there was one at one point where we experimented with photos of our own staff. Like, would that be appealing to young people to see who we actually were in our workspace and what we were doing kind of day to day? But then again, there were some other campaigns around just being able to repost, or as far as just trying to think about what's happening in the city itself and be able to show that we're engaged with what's happening in Philadelphia. And so we want to share that with you as well. But there was a huge, if I think about all the different strategies, it was just, we just tried a lot of stuff, and you just have to see what folks, what the young people are really into. And then if you can get some feedback from them, not only just in the metrics from the sites, but also just from the young people themselves, saying like, oh, I really like that, or I didn't like that. And so.
Yeah, and to piggyback on of what Marnie was saying, that transparency of using photos of your staff on your social media page so people can get to know you is so important. We had many campaigns where we would take quotes from our staff of why they liked working on the push study, and no one was immune. Like, there was even a post of the PI so that people could see who are the people behind the scenes who have come up with some of these research questions, and why do they want you to be involved with this study.
Yeah, that's great. I like, you kind of lay bare what's going on in the back end. So I think that's pretty cool. Also, I just wanted to note that the push study often interacts with my program's social media. So I wanted to thank you for that.
Yeah.
So
you guys post great stuff.
Thank you. Canva, I just wanted to also uplift as a really great free resource for content creation. So if you're thinking about kind of doing social media posts at the intersection of social media and public health, Canva is a great resource. Our next question asks, how did you determine which keywords and phrases to use for targeting?
That's a great question. So we would go to the youth for these sorts of questions of what kind of things are you looking at while you're on social media, because that's where the creepy part comes in, where Facebook is looking at all the things that you're looking at when you're on social media. And so we would come up with things, we would try to come up with things that were for our target population. That way. And so any kind of video that somebody watches on social media, that is, we would advertise to. For example, I'm thinking about cosmetics. So if a young person is looking at cosmetics on Instagram and watching videos of people applying makeup, then that person would get a study ad for the push study. But we tried to make it relevant to our study population.
Wonderful, thank you. And someone asked for a little bit of clarification. Did you interface with your participants in person other than just video calls?
Yeah, so what would happen is somebody would see our ad, they would come in for a screening and enrollment visit, and that's when they would come in for interfacing with us. And there are about 6 in-person study visits with the push study when it's not COVID, but otherwise now it's just video.
Yeah, I was going to say, I'm sure with the kind of pivot to everything being digital, you all have probably moved to video calls. How have you felt the impact of this shift, now that we're all kind of in social distancing?
Mhm. I think the hardest thing for studies, just from a regulatory perspective, is what was written into the study that has to be face-to-face versus what can be remote is one piece. So for example, the enrollment visit is a really big piece of coming onto the PUSH study, and that needs to happen in person. There's some biomarkers we have to take. There's a long consent process, as well as connecting with the coach. So we have had to stop enrollment of new participants during this time, but have been able to maintain and continue working with already participants that were already enrolled in the study. So they are still able to do their surveys. They're still able to meet and work with the coaches, presuming that they have a safe place to do so. And I think that's a hard thing for a lot of our young people, is being in quarantine and potentially having had to move back home, or move into spaces where they are, not all of their identity is out, or it's necessarily safe for them to be able to talk freely, where they don't have a private space where they can talk to their coach, or necessarily, or even just having to get off of a survey really quickly because they're worried somebody is looking over their shoulder. So that's something that we've really had to assess, is safety to participate or continue participation in the study, currently, depending on where they are. But there are many young people who are really eager to continue and really want to participate. We oftentimes get nowadays, we get queries like, are there other studies I can participate in? Is there other stuff I can do? Especially because we're able to compensate them for their time. So definitely it's harder to engage some of our young people, or, have them engage as consistently as before. And then, the halt on enrollment right now, hopefully the powers that be will be merciful, at the time of, when we're asking to have extensions for our studies. So, but it's still really busy, still really busy.
Thank you. Yeah, I think a lot of us and a lot of service providers, a lot of researchers, a lot of doctors are trying to figure out how to do this work, and, continue it with everything considered, and the horizon as places start to open. I think we're all kind of in that mode of, what do we do next? What's next? How do we move this forward? So I just want to thank you both for, continuing this, while all of this is going on. So while COVID and, the convergence of different issues are happening. So, and I just wanted to uplift that. I appreciate you mentioned safe spaces are important, and you keep that in mind. And, a lot of LGBTQ or queer youth, oftentimes their safe space is the internet. Their safe space is social media. So I think that's important. Someone asked about, can we engage youth without compensation? What are your thoughts around that?
I know we've talked about compensation a lot on this on this call. I think in part because we're always trying to make the case that should be allowed for. But I think that there are many times when we do engage young people without compensation. Oftentimes when we reached out to a young person to say, hey, would you be willing to give us some additional feedback on some of these ads? We wouldn't say to them up front that we're going to compensate them for their time. We would say, great, we really appreciate it. Can you set up a time? And then at the end of our time with them, we'd say, we really appreciate this and your time is valuable. We're going to compensate you today, for that. So, it goes both ways. Sometimes we would do it that way. Sometimes we have something formal set up where we're looking for somebody to do a certain number of hours. And so we wanted to make sure that upfront they know they're going to be compensated. So I think the answer is yes. I think there's a lot of young people who are really interested and have a great number of altruism. Right now, our Youth Community Advisory Board, I think in part because we are under quarantine, is just willing to do anything, you know, like any way that they can support us. And it's not about the compensation right now. It's really about engagement. It's really about being able to have conversations in a safe space, especially with all the social justice issues that are coming up right now. And so because we've established that, I think we're able to work with young people with and without compensation. I just emphasize it because I think it's important to do so when we can.
Yeah, I'd also tag on to that by saying, think about kind of other tangible ways that you can give back to the young person. So can that person, can you write them a letter of recommendation for helping you? Can you give them swag that you have, like t-shirts, a bag? All of those things are really helpful. And if you can give a goodie bag to somebody, I think that is important as well.
Yeah, absolutely. I like that those recommendations because for all intents and purposes, they're colleagues. You know, they're providing invaluable resources to the work that we do. So, thank you for that. We have another question. Have you experienced any issues with individuals having access to internet, data, or certain devices?
I don't believe that we've actually run into that for this study. The funders gave us money to have cell phones with a data plan. They're kind of like old brick phones that people could use if they wanted to be able to participate, but they didn't have a cell phone or if they had connectivity issues. And we never had to give any of those out to potential participants. I think that many youth have cell phones, and then if they have issues with connectivity, they'll just try to hop onto the free Wi-Fi that's around in the city. So we didn't have that as much as we anticipated, interestingly.
Awesome, thank you. Yeah, and I think that speaks to concern about the digital divide and, you know, kind of the inequities in tech and internet, you know, we see across the city and across the country. So I think that's great that you all found that it was not an issue in this study. So the next question, someone asked, are the health coaches bilingual? Just thinking about the Spanish speaking participants.
So sadly, no. And the intervention itself is not translated. The hope is that if we show efficacy, we would be able to acquire additional funding to do that. Translation is very costly and you have to be very careful about how you do it. So sadly, folks do need to be proficient in English in order to participate.
Thank you. Thank you. Our next question, can you share your current retention rate for the enrollees?
Oh,
that's a great question.
I know, I feel sad that I don't know this. It's good, but I'd have to get back to you on the exact numbers. I would have to get back. It mirrors very much our retention rates for our clinical side of things. Anderson, are you breathing because you have an answer, you think, or?
No, I'm not sure. I don't know how to answer the question. Sorry.
Yeah, no, I haven't looked lately at the retention rates. We do get those on a regular basis. But also we look at retention over time. So we have our 6-month retention, 12-month, and then we have a closing visit at 18 months where we do an exit interview with folks. So I don't, and it also varies, retention also varies across the 3 different sites. So I can tell you that it's good, but I don't know the exact number. I'm embarrassed to say today.
I guess I would say the only thing is once you get somebody in, once somebody is enrolled in AIM 2 or 3, usually they're pretty gung-ho and pretty interested in participating, so people don't fall off too much. It's just getting people in for that initial visit, and I think that is mirrored in all the adolescent research that we do. Just getting somebody in is one of the biggest hurdles.
We do lose some folks between, I think, the baseline visit and the very first visit. That's if it's a 3-month visit and there's a 3-month lag. Sometimes that if we're going to lose folks, that's usually where we do. But I think Anderson is right. Once we get them in, then they stay. It's pretty rare that that somebody ghosts us after they've been in for the first couple of visits. but I don't want to throw out a number that is potentially incorrect.
I appreciate that commitment to ethics. I just have a question. This is a study that happened across different states. What was your experience working with the other organizations and different locations? What were some things you appreciated about it, and what were some barriers or challenges?
We found that it was really hard Philadelphia really took off with creating ads and being able to have success with people enrolled, but those ads did not yield in Baltimore or DC. And I think it really shows that you need to tailor to your audience. You need to know your audience, even though it's sexual and gender minority, adolescents, and young adults in the three different areas. Those are three distinctly different areas of the country, and so that is reflected on who was able to, how those ads were interacted with.
Yeah, very early on, we were asked to kind of take a lead on doing the social media here in Philadelphia. I think and that's testament to Anderson's work, and they were hoping that centralizing it would allow for all the sites to benefit, but it does make sense to have things like the Philadelphia landscape in some of the ads, or reflect what the urban center looks like, whether you're tapping into local campaigns or local issues, to be able to do that on a regular basis. Our team, fortunately, is savvy in lots of these things, so can keep up with it more so than some of the other sites. But overall, these are institutions that we've worked with in the past. So when we came together to do this project, it was very collegial because we all knew each other already. So in that respect, it was kind of nice. It's kind of like when I call you, Kyle, I'm like, Kyle, you want to do something? We're like, yeah, let's do something. So, so that definitely helped too.
Wonderful. Yeah, thank you. Thank you. I can imagine, yeah, these are institutions you have working friendships with, and I appreciated the bit about building familiarity in the social media post. Someone's not necessarily going to respond to Center City, Philadelphia, if they live in, Baltimore. So I think that's a good key piece of advice. So it looks like our audience is a little shy today. We got some good questions out of them. Thank you, everyone, for sticking with us. This is our 19th webinar, I think it is. So thank you to everyone for coming along. Before we kind of close out, what are some, I just want to open up the floor to both of you. What kind of things do you want to impart to our audience before we end today?
Sure. I would love to see people being able to use Messenger to be able to interact with their participants. I think that if you can build that into your IRB when you submit, I think it's really helpful to be able to engage young people. So my recommendation would be to try and use Messenger as much as possible to be able to interact with potential participants who like your ads or like your content. I think it'll make a world of difference.
I think as someone who is as a PI and kind of a director of these types of projects, so if you want to utilize social media in any way with any of your projects, it's always going to take a lot more of your staff time than you think. I think, moving forward, folks are learning to build some of this in, or to identify somebody on their team who can really, take it on as a focus, which I think is really important. I don't think it can just be an add-on or a throw-on, like, oh, you're the research assistant and you're going to do all the ads too. It takes a lot of time, and you have to allow for flexibility for folks to be able to do it when and at the time that your audience wants to see it, and to be responsive to things. I know that for example, Anderson would say such and such happened over the weekend, so I posted, on Saturday. And I'm like, oh, okay, that's not when you're usually doing stuff, but you were paying attention enough that, you posted for us. So when you're building this into your work, just keep in mind that if you think it's going to take, a day a week, it's going to take 2. as far as like hours or whatever is concerned. And as long as I go into it that way, then I think it's managing projects. I think you won't be as frustrated. And I think we need to learn to ask for support for this type of work and positions for all of what we're doing, especially for our young people. I think it's really important that we don't do them a disservice in this area.
Thank you for that. I appreciate that. And I think, just to sum it up, communication is key. Use Messenger if at all possible, and be flexible. And social media is a lot more work than we realized. So I want to thank you both for sharing this information. And once again, to the audience, thank you for being here. Thank you for joining us. I hope everyone has a great rest of your week. I hope you're all kind to each other and kind to yourselves. So thank you so much. Take care.
Thank you.
Thank you.